You're listening to the Applied Natural Medicine podcast, showing how the science of naturopathic, integrative, and functional medicine is applied by clinicians in real-world practice. This is a production of NDNR, publishers of the Journal of Applied Natural Medicine since 2005.
Hello, everyone, and welcome to today's Applied Natural Medicine podcast. I'm your host and medical director, Dr. Kareem Kandil, and today we are joined by Dr. Joseph Thomas to discuss hyperbaric oxygen therapy in sports medicine, and are also joined with Shah Haq from Oxygen Health Systems. All right, so let's say you have an athlete suffering a concussion. CT scan may be normal, MRI may be normal, yet weeks later they're still experiencing headaches, brain fog, dizziness, fatigue, sleep disruption, and difficulty concentrating. Perhaps you may be dealing with someone who has a sports injury, meniscal tear, rotator cuff injury, or muscle tear that's healing far slower than expected. Now, in both scenarios, oxygen delivery to the injured tissue may be impaired despite normal oxygen saturation. Today, we're going to be discussing whether hyperbaric oxygen therapy can help bridge that gap. And we are joined today to discuss the role of hyperbaric oxygen therapy in sports medicine with Dr. Joseph Thomas and with Shah Haq. Welcome today. Thank you.
Thank you for having us.
Thank you for having us.
Absolutely. So, Dr. Thomas, let's just start with the big picture. Many clinicians may associate hyperbaric oxygen therapy with wound care, diabetic ulcers, or even decompression sickness. Now, why has hyperbaric oxygen therapy become increasingly of interest in the realm of sports medicine?
Well, that is one of the most important questions we could start off with, because the average doctor, or certainly the public, probably is not aware that microvascular blood flow is the single most important thing that determines what gets delivered to the tissue or not. And so while we're familiar with the 1%, which is the blood vessels you can name, the 60,000 miles of capillaries that are so fine, like 20 could fit into the size of a hair. And it is, even though it's been out since 2009, it's still hidden that there's a machine called a glycocheck machine that goes under your tongue. It measures your microvascular blood flow. And I went to my family reunion, and I thought I was going to do the 12-year-old and get a good score and then test my 50, 60, 70-year-old cousins. The 12-year-old had the worst score. And so I say that to say, even if you eat a good diet and so forth and so on, as you get older, the microvascular blood flow decreases. And so it cannot deliver the optimum amount. Even though Henry's law will force more oxygen under pressure, how far away are the capillaries? So when you have rarefaction or destruction of the capillaries, you cannot get the nutrients or the oxygen there. And that's where I'm going to do a dividing line and say, if you really have diabetic with ulcer or a wound that won't heal or severe traumatic injury, you need the higher pressure to force it even more to the tissue than the mild hyperbaric oxygen would do. But if you don't have a scuba injury or a diabetic or those things that are covered by insurance and that are really severe, then there is some benefit from mild hyperbaric oxygen therapy. And I'm just going to say 1.5 atmospheres or less, and then the over 1.5 or 2.0 or 3.0 are the other hard chambers. So they both have a place, but what's going to happen, the more people find out that tremendous number of sports injuries are being treated with hyperbaric, and I think everybody probably heard Michael Jackson had one, and a lot of people know that LeBron has one. And in fact, I talked to the guy that, I'm going to say medical director that was in charge of it. And not only did they have that, but it helps them recover. And so as a side note, I couldn't wait to tell my cousin. I have a cousin, her 15-year-old daughter ran 100 meter in 11.8. Now, there were two people in the Olympics who were over 11.8. So she's world class. I couldn't wait to tell her, hey, you should use hyperbaric and recover. She said, well, you know we live in Texas, right? I said, what does that have to do with it? She says, they put the kids in the hyperbaric before the race. I said, oh my goodness, some places are going to hear about it a lot sooner than other places. And the difference is, as people really understand microvascular blood flows decrease, then to get the oxygen where it needs to go, you can't sit on the couch with oxygen. There's no increased pressure. It's not going to work. You actually have to have increased pressure, and that's what hyperbaric oxygen is.
Excellent. I mean, you definitely touch on some very important points, especially in regards to the microvasculature and, impairments in nutrient delivery that we see across a number of different pathologies, obviously diabetes, hypertension. But I mean, even following COVID, we've seen lots of damage to people's, microvasculature. So there can be a lot of contributors, to this poor delivery. And that's ultimately, where the buck stops, even if the larger arteries are, functioning just fine. In regards to that, can you, I guess, explain a little bit more of the mechanism and importance of hyperbaric oxygen? I know you mentioned that the increased pressure is what's necessary in order to help, force that oxygen into the tissue. But can you talk a little bit about what happens in injury, issues of localized hypoxia and where hyperbaric oxygen can help in that recovery process?
Oh, sure. So as you know, and everybody should know, you don't get healing if you don't have blood flow. And people kind of understand that because the person who has diabetes, where the sugar has caused peripheral artery disease, those are the ones that have the worst healing. Those are the ones that end up with the most amputations. Those are the ones that end up with kidney failure. So if you can't get the nutrients and the tissue becomes more and more acidic, then the mechanism of healing includes immune cells going to the area, but they migrate from the blood vessel. But you can see areas like where there's no blood vessels. So you'll see 2 or 3 in an area that the person has a better score, there's 10. And so it's like, if you don't have irrigation to the crops, you won't have the crops growing. So it's the same thing. You got to have blood flow. And for those who like to read the book, it says the life of the flesh is in the blood. So from that point of view, it said that thousands of years ago. Now we're able to see, and I personally don't have the TCOM where you can put the electrodes on the person and actually measure the tissue oxygen. I happen to know that the pulse ox doesn't work on African Americans. It reflects back from their pigmented skin and gives a higher reading than what's actually there. And that's what they found out in COVID. Oh, their pulse ox looks okay. And then they had plenty of problems of, as you said, ischemia, hypoxemia, because we're not really measuring it. We think the pulse ox should be okay. Actually does a scan using infrared, and you can see how much blood is in the area. So what you have to heal is the right cells getting to the area that's injured. Of course, if you have, let's say, actual cut, hemostasis have to occur first. Then second is inflammation. Those are the inflammatory cells, the immune system moving in. And then you have to have proliferation. And those are the first 3 steps. It remodels for the next year or 2. So if you don't have sufficient blood flow, you're not going to have the steps for it to heal, whether it's actually a cut or even just a sprain. And of course, a sprain is actually a tear, but we like to use that euphemism. So you need to have the best blood flow so that your immune cells can actually get there, so that if stem cells that need to participate, that they can get there. And with poor microvascular blood flow, it doesn't happen. And more to this topic, the oxygen can only diffuse so far based on Henry's law. And so that's why this is so important, because it's going to go much further. Even the low pressure one is 400% more oxygen in the tissue than you just breathing room air. So I agree 100%. Everybody goes to the hospital. If there's any question, they'll put them on 2 liters of oxygen. Partial pressure of oxygen in the tissues as high as even the mildest hyperbaric oxygen chamber, let alone the 2.0, 2.5. So it's very important to understand the steps of healing are the same no matter what the injury is, and that you have to recruit the proper cells to come there, and that takes the blood flow and it takes oxygen. And the oxygen also reduces inflammation, because you don't want chronic inflammation. And there are other positive effects from that extra oxygen.
So let me interject that in general, you two, I'm just a dumb engineer, you two are MDs.
No.
The general understanding is that between 1 to 3% would be the oxygen absorption into the plasma under the pressure. But when you exert the pressure into a pressurized, chamber, the oxygenation into the plasma or our secondary oxygen transport mechanism would be 15-fold and 20-fold. If you recall the paper that was published in 1959 by Dr. Ite Boerema, Boerema, you could find that in PubMed NIH. He clearly proved at the University of Amsterdam, where he took the pig inside the chamber, draining the hemoglobin, gone, and then he replaced it with a plasma-like solution. And then he monitored the pig for the next 3 hours where the pig was alive, with some of his, basal metabolic functions being monitored, which was, near normal. So the question is, how does this pig stay alive? The doctor's first question. It is simply because the pressurized, the PV equal nRT and a whole bunch of laws beyond the scope of this discussion. But the bottom line is the introduction of oxygen through the secondary oxygen transport mechanism, plasma.
That's a very valid point. Again,
15x, 20x. And you could find that paper. It's called Life Without Blood. He originally published the paper in Dutch, which is called, if I recall correctly, Leven zonder bloed. And you could find it.
That's a fascinating study, and I think it just speaks to the fact that even though hyperbaric oxygen is definitely having a bit of a comeback in terms of people's awareness and its use therapeutically, it by no means is it like a new innovation from a medical perspective. It's been around, it's been studied, for decades, for numerous applications. And that actually kind of brings me into one of the next applications I want to talk about that we also see in sports medicine. But rather than, thinking about your typical muscle tendon injury and, issues that are taking place with the microcirculation there, when it comes to brain concussions and metabolically what we see happening within the brain following concussion, especially when it comes to issues like mitochondrial dysfunction, neuroinflammation, changes in cerebral blood flow, and glucose utilization. So if you want to chime in, how do you see hyperbaric oxygen fitting into a concussion recovery plan? And if you could just kind of tell us, give us some examples clinically of what you've seen with the changes of introducing hyperbaric oxygen therapy in concussion patients.
Well, I think
we'll let Dr. Thomas talk about the concussion, and then I'll touch on UPDRS at a later time after he's done.
Okay. Well, getting right to the point, I think the most important overlooked factor is that, and it's becoming more and more understood, but that chronic inflammation, the microglia cells, which is the immune cells of the brain, once they're turned on into an inflammatory state by, it could be a concussion, it could be like a little bit of neurodegeneration. And in the movie Concussion, they went through great details to say one concussion can turn these inflammatory cells on for 17 years.
Wow.
That's what that whole movie was about. These football players had a dramatic bad outcome because they had neuroinflammation. So the hyperbaric oxygen turns off the microglia, and so it reduces inflammatory state, and now it can allow the brain to heal. For the brain to heal, the lymphatic system, which is the lymphatic system of the brain, at night when you sleep, when the body heals itself, the brain actually shrinks a little, and now the lymphatic system is able to get the toxins out of the brain. And so it's a process that not only requires lymphatic flow, but you can't have an ongoing chronic inflammation and expect to heal. Just like if you injure your ankle, they tell you to rest it because you can't keep injuring it and think that your ankle's going to heal. So it's really kind of almost that simple. So that's I think the most important aspect of it. Vasoconstriction, which is not good, actually can happen if the oxygen level is too high. So some of the side effects of the 2.0 and 3.0 atmosphere pressure can actually increase the oxygen to the point where there's some vasoconstriction. And so you have, hypoxia situation that can come. And that's why they will reduce the pressure on, and he can tell you about their different protocols to try to mitigate that.
Here I wanted to interject something that came to our attention as the hyperbaric oxygen chamber design and whatnot. We came to this gentleman, his name is Dilbert, and his neurologist, by the way, he had the issue with trembling, Parkinson. So anyway, the doctor called him up and said that, explained to him that impediment in dopamine production in your substantia nigra and all that stuff. And then said, well, we have to come up with a plan so that your UPDRS, Universal Parkinson Disease Rating Scale, can be monitored. And based on that, we will determine if your return to your normal life can be somewhat made comfortable. So anyway, the gentleman used to be an avid outdoor photographer that required huge lens to capture wildlife. And needless to say, his wife said that he would tremble and he couldn't do the things that he loved to do. So anyway, his UPDR score was 21. And so the doctor came up with a protocol dealing with mild hyperbaric. What is the pressure? Let's talk about some specifics. 1.4 ATA, gentlemen. It's not 1.6, it's not 2.0, or we have even 3.0 ATAs. That's a lot. The neurologist recommended and prescribed 1.4 ATA between 3 to 5 times a week, only 2-day break, continue for 30 to 40 sessions. Then the neurologist would recommend whether to repeat the cycle or not. And he did that, continued for a year and a half, and his UPDRS score, the next time he went to the office, dropped 14 points to 7. The office called him back and said there were some potential errors and we need to bring you back. So they reran the test. Once again, it was 7. And then the doctor concluded, that, well, there's not enough clinical studies, there's not enough clinical evidence, but I, don't know, idiopathic, I don't know, but your, result may have been contributed by this hyperbaric. So needless to say, additional research work is needed, but that was a true story. And now the gentleman goes back, taking his long, heavy lens outdoor, doing the things that he loves to do, and that is taking outdoor photography. True story.
No, it's always excellent when you can start to see that kind of recovery. And I'll be asking a little bit on some of the protocols, but I think you brought up a good point on sort of that, ideal 1.4 ATA atmosphere absolutes in terms of pressure. And I think that kind of brings to question an important aspect of balance when it comes to oxygen. So, I mean, we know that, in the lungs, low oxygen tension causes, vasoconstriction. In the periphery, excessively high oxygen tension can cause vasoconstriction in a paradoxical fashion. And, it definitely seems, looking at the studies, that there is this therapeutic window that seems to be optimized towards the lower end. And of course, oxygen is necessary. And in fact, within the body, we have this balance between oxidative stress and antioxidant capacity. And obviously in, the functional and integrative health space, there's been a lot of, buzz and interest around antioxidant therapy. But, I think just like with anything, you can have too much of a good thing. And sometimes people may try to go a little bit overboard with their, antioxidant supplementation, or maybe concerned about getting into any sort of therapy that uses, higher pressure oxygen or ozone therapy, for example, with concerns of that maybe leading to more oxidative stress. Could you perhaps kind of tackle some of these concerns while sort of addressing that element of finding that balance when it comes to, making sure you're giving adequate oxygen delivery to optimize physiology versus giving too much and potentially impairing it?
Dr. Thomas, would you like me to state the Efrati, Dr. Efrati, what you recommend? Okay, so I'll finish there and then Dr. Thomas can carry on thereafter. So the controlled hormesis, controlled toxicity. So Dr. Efrati talks about balance it with hyperoxia, immediately followed by hypoxia. So generally speaking, the sessions are between 60 and 90 minutes. And NOAA guidelines, National Oceanic and Atmospheric Administration, their guideline is there's no toxicity or any remote possibility of toxicity, oxygen toxicity, within the 2-hour window where someone could go possibly diving. So as we are simulating that environment with a 33 feet depth of water with a 2.0 ATA, the same rule applies. Having said that, what Dr. Efrati did, brilliant. He recommended that on a 60-minute session, first 20 minutes, the hyperoxia, so you use the mask, followed by induced relative deprivation. So you take off your facial, apparatus, no oxygen supply, you are just breathing the ambient between 21 and 23.5% of oxygen concentration. And then after that 5 minutes, repeat that 20 minutes hyperoxia, mask on. And then 5 minutes after that 20th minute, induced hyperoxia. And that's where he found out that this controlled hyperoxia and hypoxia, which he called the HHP, hyperoxic-hypoxic paradox, if you go to PubMed NIH, you'll see that that's how he was able to create the fundamental framework for stem cell proliferation, or some of the other results that he noticed was the telomere length increase and so on and so forth. So your original question was balance. So the recommended protocol suggests that instead of using the oxygen mask throughout the whole session, give that break or air braking. So it is through the air braking that you achieve the highest efficacy clinically possible.
There's an element to the contrast between the, hyperoxygenemic and then sort of like the hypoxic that essentially stimulates, if you would, that blood flow without having or leading to real concerns of oxygen toxicity.
Control.
Well, more to the point, that difference, and I don't know the mechanism and I haven't read it, but that difference, and I'm just going to say going high and low, stimulates the stem cells the best. So it's a change, it's a variation in the oxygen level that seems to stimulate the stem cells, and so they increase, and it's not proportional to like the higher you go, the more stem cells. No, that's not it. And so that's why it's important, as Shah was saying, that we need to look at the protocols and follow them so that there is that change, and then you'll have a better response. And that's why we could draw the line. So at my hyperbaric oxygen center in Chicago, I'm in Beverly neighborhood of Chicago. I only use mild, which is 1.5 or less hyperbaric, but I've seen some dramatic results. So I had a lady, I said, well, you could try it, because she brought her mother in that has Alzheimer's. She's forgetting the grandkids' names and other things like that. And I said, well, here's the study. You can read it yourself. One treatment helped for about a month, but you really should do 2, 3, 4 treatments every week for 8 weeks to get the best result. So she came in, got one treatment, and within a couple of days, she said, hey, it works. She's remembering her grandkids again, and so forth and so on. And then she called me like at day 28, and she says, we got to come back because it's fading now. She's going back. So seeing that is very encouraging to me personally, because I think after you get a certain age, there's something right around the corner that you want to avoid. And so you don't have to wait to get it. How many of my patients can't remember when they park when they go to Walmart?
Yep.
At 20, you don't need a list. You go in, get what you want, come back, go straight to your car. After a certain age, all these people are hitting a beeper on their car, and I want to tell them, stop making that noise, because I'm trying to beep my car. From my point of view, there's a place, and I would enjoy, we have an affiliation relationship. I would enjoy getting people to get their own hyperbaric oxygen chamber for their home. I've already had one of my patients do that through oxygen system, because from his point of view, he was getting it for his son that had a grandson that had difficulties. From my point of view, he needed it himself. Because you can't be smoking cigars and thinking that there's going to be no damage.
Yep.
So, we can get into the, hey, if you have a bone injury or infection, you got to have the high pressure to get to it.
That's
Don't
true.
even try that lower pressure. That's not it. So it's a
So,
dividing line
yeah.
where there's certain things you need the higher pressure. And then what I call my community center, the everyday people can benefit from a lower amount. And instead
Mm.
of like the $250 an hour they charge at Northwestern, mine is much cheaper. And I help people, try if they need it for themselves or their family, to try to get it in their home because that's where it's going to do the most good.
Hmm.
I don't know even know
It's,
if that answers your question.
there's a personal experience interjecting on the bone side. I was a martial artist for many years. I have a black belt in Taekwondo. So once I finished my Taekwondo routine for 5 years and couldn't do any more simply because of repeated trauma,
Hmm.
I went to my orthopedic surgeon and I said, hey, there's this pain right at the femoral head. So after an MRI, he said, Shah, I have a good news and a bad news. And I said, give me the
Hmm.
good news first. He said, you're in good health and you're very active physically. So after I suggest this surgery, it would be an anterior incision, and you should be out in up and about by 12 weeks. So anyway, I went ahead with my arthroplasty, femoral head replacement, anterior incision, mechanical dislocation, titanium plate, rod insertion, femoral cap back on, and all that stuff. Then, anterior incision, closed in. And then he told me, okay, wait 24 hours because I want you to get all that anesthesia, effect and whatnot, especially
Hmm.
your kidneys. And then after that, go to the hyperbaric chamber in the highest possible pressure possible. So I
Mhm.
had access to 2.0.
Mhm.
Anyway, I did not adhere to a Friday protocol. Rather, I went with my orthopedic surgeon's recommendation. He said, look, there would be some tissue necrotization. That's inevitable. I went as best as I could to minimize the damage to the tissues as
Hmm.
much as I could, but use every day for the next 10, 11 days or so. So I did that. Summary, on my 5th week, I went hiking. Now, I'm not a physician. I cannot claim that hyperbaric made the difference. But when I went back to him, he said, you know what? Your cadence, your gait, your rest of the things that I've tested seems normal. Keep doing what you're doing and then come back and
Hmm.
see me X amount of days later.
Yeah, I mean, so it definitely, so this kind of was going to bring up the next point. So, I mean, there's definitely this nuance. And as you mentioned, for the brain health support, neurodegeneration, concussion, seems the lower pressures are sufficient in order to make that benefit. However, when it comes to, deeper injuries, surgical recovery, tendon repair, these deeper structures are oftentimes going to benefit from that higher pressure. And, one thing was interesting is how soon after the surgery that you went ahead and started using hyperbaric oxygen therapy. Because I know that obviously in the acute inflammatory phase, part of the body's, reason for, that slowing down in the microvasculature is to help with that, recovery process. But ultimately, we don't want to be stuck there. We want to support perfusion. So when it comes to, recovery for various physical injuries, are there any injuries that seem to respond a little bit, better clinically? Does it seem to make sense starting right off the bat, or to maybe give a little bit of the, acute phase of recovery to take place before we jump into hyperbaric oxygen? I'd love to hear your thoughts more on that, Dr. Thomas.
Well, my thoughts are varied because on one hand, I had a patient who was actually hospitalized for 2 weeks at Northwestern. She had had a stroke
Hmm.
and she lost her vision such that they mapped her vision. And she said, well, you don't have any peripheral vision. It's all central. And
Hmm.
you have to give up your driver's license. And she had mild difficulty putting her clothes on and had a headache for 6 weeks because she had a little bit of a brain bleed. But they said, we really can't do anything because it's so deep in the brain. You're doing much better. So they let her go home. So she found herself to me. And to my surprise, one treatment, she said, halfway through the treatment, my headache is gone. I've had a headache for 6 weeks. So I can't
Mm.
give you the physiology, but her report was finally, And by the third treatment, she already had an appointment, went back, they mapped her vision, it was back to normal. So they now have, and I don't have it, but I'm going to get both of her scores. They have 2 visual mappings showing that the only difference was a week or 2 later, she'd had hyperbaric oxygen treatment. Now, the interesting thing is, kind of humorous, but she went to, well, she's a 30-year veteran of the police force. So she went to somebody's retirement, and she told me, when I walked in, everybody was whispering, isn't that the girl that had a stroke? Isn't that the girl? So as she went, it's like a couple hundred people there. So when her music came on, she started dancing and went all the way down, came back up, and they were like, oh my God, she looks like she never had a stroke. So she had recovered enough where she could dress herself with no problem. She wasn't using the cane. And this is about, I forget now, but about 5 treatments with mild hyperbaric. So we really don't have it. So that's why I try to rely on the studies. And I'm sure Shah has the same ones, but the Air Force Lackland study, I think they call it the Wolf trial, demonstrated that significant improvement in post-concussion and PTSD symptoms when compared with 2.4. So they proved that the 1.3 ATA is an active biological dose, and that you really couldn't say it's placebo because it actually did something. Cytokines, they did another study, low versus high. That was done. They mapped 71 cytokine marker panel, and it proved that it helped regulate the low-grade inflammation and downregulated the systemic interleukin-6 and TNF alpha, so that even the low pressure reduced the inflammation, and that was the whole point of improvement.
And did they also study at the high pressure, the 2.4 in that study, or was that more at the lower?
Okay, this score was the research citation. The paper is cytokine regulation and anti-inflammatory signaling, and it was measuring 2.0 versus 1.3.
Okay.
And they mapped 71 marker cytokine panel and just showed it was statistically significant, but this abstract doesn't say, it just says it's significant. It doesn't.
Okay, gotcha. All right. But it seemed that both of them seemed to have that, efficacy. But it was definitely demonstrated that even the lower one was therapeutic in that regard. Okay.
Right. So
yeah,
there's 10 or 20 studies where they did compare it. The post-exercise muscular trial shows that it helped get rid of, this is mild, after maximal exertion, it helps get rid of lactate concentrate and improve heart rate recovery, antioxidant capacity. And that's in the Journal of Exercise Rehab. And that there were, again, statistically significant acceleration of clearing of blood lactate, and they had reduced muscle fatigue and stiffness and those other markers. So in the clinical sports medicine world, there's improvement, but I don't think there haven't been enough studies to say, 1.3 is not as good as 1.4, not as good as 1. So they've done a couple of studies, 2.0 versus 1.3, and said, hey, there's something positive happening. And, that's why I encourage it for anybody. And like I said, when I found out my cousin's daughter in Texas, they're doing it before the race. I'm like, they're on a whole different level. Because I was trying to tell her about recovering, because, the kids in track and field work out really hard. In fact, one of the places, anybody's in Chicago, there's a place called Gately's Dr. Conrad Warwheel. It's a $56 million Olympic track at 102nd and Cottage, and it's underutilized. So I try to get my patients, you at least got to go walking. That's the best way to at least do something to get your blood flow. So we're here on this podcast on the other end of things. Let's use some technology and improve it. I said, well, that's fine and good because they see my units when they walk in. But I said, the first thing to do is start moving. So that comparison, as you know, the greatest improvement comes when a person goes from sitting on the couch to just walking. So you can do a whole lot more exercise after that. You got 30% reduction in all-cause mortality from going from the couch to walking, you might get another 2 to 5% when you're really exercising hard and you're, at an elite level. It doesn't improve that much. But I still encourage my patients to look at it like the number one nutrient, and I ask this question and nobody gets it. What's the number one nutrient that your body needs or it dies?
Oxygen.
It's oxygen. I didn't know oxygen was a nutrient. Well, try not getting it for 4 minutes and see what happens.
It's the final electron acceptor. I mean, without it, there's no cellular energetics. So.
There you go. And the part that people don't know yet is that the glycocalyx is negatively charged. It lines the 63,000 miles of your capillaries. It's the size of a soccer stadium. And so when people are doing grounding, that's what's holding the negative charge. That's where the glycocalyx is that releases the nitric oxide that causes vasomotion, that causes you to be able to change. Your body can ask for, and then it will deliver more oxygen where it's needed by vasomotion, by, if you really work at it hard, angiogenesis, so you can get more blood vessels. So it's a whole science, I think, that's it's already invented, but it's going to be looked at in a whole different manner. And you're on the cutting edge of healing things that they didn't think was possible before. So rather than send patients home after the stroke in the hospital, I think they should all go, maybe Shah, you could tell me when, after a few days, should they get into oxygen chamber? Just put it on low so that the tissue is getting it. Now, how did that person who had a stroke regain their muscles? Well, the amount of tissue that's dead might be the size of, let's say, a period. Smaller than an eraser, but the cells around it have been damaged because of hypoperfusion. They were relatively ischemic, and it's like your car battery. It's not starting the car, but the battery's not dead. Well, we're not bringing dead cells back to life. Don't get me wrong, but I call it the Lazarus effect. The master said he's not dead, and then he called for. Some of those cells aren't dead. You give it oxygen, they start up like the car battery. Once you jump it, the alternator's working, the generator, and now that battery is working. But there's some batteries, that battery is dead. And so those cells are not going to come back just with hyperbaric. So I don't want to have people overthinking that it could fix everything. No, it can't. But it can help it if it's been hypoperfused and injured, but not dead. So that's where the secret lies, and that's why the pressure is important. And, the laws of physics, Henry's law, more pressure, it'll saturate more into the tissue, even though it's far enough away from the capillary that ordinarily you wouldn't get that oxygen tension in the tissue.
Excellent points. Now, I know we definitely discussed, elements of dosing, and oftentimes where that lower dosing, can be a great and effective start. But another, component is the number of sessions and in terms of seeing clinical improvement. And of course, a number of studies report protocols of, 30 to 40 sessions. Do we begin seeing clinical improvement? I know you mentioned some cases where in the very first session they saw that, but, let's say when patients are doing that decision-making process, considering, the costs, benefit of coming in to the office for treatments, versus perhaps, having a machine at home where they have the liberty of doing, far more frequent treatments. Is there, I guess, a decision-making process in kind of determining how many sessions a patient, ought to have when it comes to hyperbaric oxygen therapy?
Well, the worst scenario, the more they're going to need. As an anecdotal story, one of the clerks at the health food store that I send my patients to had to have MRIs and CT or whatever, and had gabapentin. So she went to the hospital. They said, nothing else we could do. The medication we tried to use to flush it out your system and so forth, nothing. So they told her, Mom, you need to put her in an institution. So Mom was one of those who I call them the no stone unturned people. People who will, I don't care what you say, I'm going to look and see what else. So she actually went to Florida, moved into a motel nearby, and did daily hyperbaric 5 days a week for 2 months. And the woman is the clerk at the health food store telling me the story. It took her a while. She had to learn how to walk again.
Mm.
But after the 6 months, she's back to walking. If you look at her, you can't tell she was ever paralyzed. So I
Wow.
like to say it like this: when you work out, you know it's time under tension for your muscles to
Hmm.
improve, right? So if you move your muscles through that resistance slowly, you have more time under tension and your muscles develop better. Well, I think it's also time under tension, but this is oxygen tension. So
Hmm.
the worse you are, you might need, and the protocols say it, you might need 30, 40 sessions.
Hmm.
That young lady, I think they were doing an hour, hour and a half, 5 days a week for 2 months. And it took them a month and a half for her to have improvement. But
Mm.
that's an anecdotal story. You can look in the literature and see all the areas are saying the more severe it is, 30 to 40 sessions. And at a certain point, when people have the wherewithal, I advise them to, get a unit. And Oxygen Health System is very good. I think, Shaw, you told me you guys like had to open a wall and a window on a second floor and had a crane put it into, the second floor because some of those units are so
Yeah.
big, it's not going to make it through the front door.
Right. That was a plastic surgeon in California, Newport Beach. The gentleman treating neck up and neck down and needed a chamber that would be a little bit more comfortable. Post-invasive surgery for neck down patients are extremely uncomfortable. They cannot
Hmm.
take face masks. The only thing that they can do is nasal cannula. For patient comfort, so he needed to knock out the entire second floor, wall and get the chamber craned in and then have the reinforced. I worked with the architects and, we're engineers, and then have the floor reinforced to accommodate that weight on a per exerted force from each wheel. There are four of them.
Hmm.
The guy's like phenomenal at any cost. He wanted to provide something for his patients and he made it happen. Yeah.
Mhm.
So kind of like one final note here before we kind of get to closing. I mean, we definitely discussed, a lot of the benefits of hyperbaric oxygen therapy, the different indications and patients that can benefit from it, the typical dosing in terms of oxygen pressure, as well as the number of sessions, depending on severity. One thing I just kind of want to briefly address would be concerns of relative contraindications and safety considerations. I know you mentioned in your article that untreated pneumothorax is an absolute contraindication. Can we talk a little bit about some of the relative contraindications and concerns for patients that may be evaluating hyperbaric oxygen therapy?
Well, but before we get to that,
Hmm.
I want to mention that the article called Endothelial Dysfunction and Cardiovascular Disease, Hyperbaric
Mm.
Oxygen Therapy as an Emerging Therapeutic Modality. And this is all the way back, I say all the way, 2024, that the same improvement in reducing the harmful cytokines or the inflammatory response in the heart is responsible for people recovering much better with hyperbaric oxygen if they have certain types of cardiovascular disease. And the non-occluding microvascular disease is the number one thing that's being missed. And you can have a normal angiogram, you can have the EKG, the stress test is normal, and then within 6 months, they're gone. Because all you got to have is a little spasm in these microvessels. And now the heart is depleted to the point where this time you don't have recovery. And so I've had a case where the lady went to emergency room with chest pain, 75% blockage. She took some nutraceuticals that
Hmm.
have fucoidin, which is one of the things that's like the
Hmm.
to
For supporting the
replenish
glycocalyx
the
from the CV. Yep.
glycocalyx. And in 9 days, she had 20% block. So I talked to all the different people. They're like, oh, we don't think that can happen. She must have had spasm. So that is something that because she stopped doing everything right a year and a half later, she had another episode with 56% block. And the oxygen plus the agent, yeah, that's it, helped her go from 56% block down to 16% in 2 weeks. So again, she didn't have to have a stent. So on one hand, there are a few things, and we could go through the list of when you shouldn't have it, but there's so many things that it's going to help. You can't even make a list of all the things that it could help. And the public needs to know that, because as soon as they go to their doctor, the doctor's going to say, well, he was trained. These are my golf buddies who are doctors, and they're repeating stuff from when they was in medical school 30 years ago. So people can really be misled if I don't have the right condition. Well, you don't have the right condition for your insurance to pay for it. But why you want to have neurodegeneration happen, and I'm going to just mention this for your viewing audience, there are 3 conditions that are totally not told to patients that they have. Starting at 30, you have microvascular disease. Starting at 30, you're starting to have muscle wasting or sarcopenia. And the main reason, the last paper last year came out and said it's neurodegeneration that leads to sarcopenia. They think it's a neurological. So the neuromuscular junction, the nerve is disconnected. The new nerve tries to work, but it doesn't work as well. So you have to do specific exercises. Those are fast twitch muscle fibers that are being degenerated. And look at this. Maybe the oxygen and the specific nutrients and the specific exercises to improve fast twitch muscle fibers would stop not only neurodegeneration, because neuroplasticity, when I was in school, they said, oh, after 28, that's it. You don't get any new brain cells. But now they say, oh, neuroplasticity. So the whole thing, the whole landscape is going to change, because there's enough PhD level research that's proven it, but it's not being connected. And they need to have a better way of getting the results that have been published to the public where they could use it, instead of it being hidden in the back of the journal where nobody could see it. And one other shameless plug, I give talks and mention that here's an article that shows only in Black Americans, the 1 omega-3 pill a day reduced heart attacks by 77%.
Oh, wow. At
Never,
what dosage
never
of omega-3 do you know what the...
1 omega-3 pill. It didn't help any other ethnic group.
Wow.
But wait a minute. I've done the research, because when they came out with the glyco check and they said, oh, Black Americans, Dr. Hans Vink from the Netherlands said, oh, Black Americans have the worst microvascular blood flow in the world. Wow. I said, well, why is that? He said, we don't know. He said, but we're not going to publish that, but I'm telling you. So I've spent 2 years doing a deep dive, and I could tell you there's 7 things that include not enough nutrients, the least amount of fruit and vegetables per day, the lowest magnesium, the least amount of omega-3, the least amount of exercise. It increases the microvascular damage. And what's central is, if you use hyperbaric oxygen, it could defeat some of that. Now, you can't defeat a vitamin D deficiency with hyperbaric oxygen. You can't defeat omega-3 with oxygen. But if you do a combination, your body has the blueprint to heal. And that's why my practice is now called scarless healing, because your body has been trying to heal itself scarlessly from the beginning of time, but you're not given the right nutrients. Everybody thinks you just put gas in the car. What about the oil, the transmission fluid, the brake? We're not really looking at the whole picture. And back to your point, yeah, if you have too much pressure in your chest, you can blow it out. I was playing basketball with a kid when I was in medical school. We just practicing around shooting free throws, and he fell on the ground. He had a pneumothorax. Who knew that he was predisposed to that? So you're going to have some complications just in general, because people can get a pneumothorax. But that's the type of thing where you should avoid it if you know you have a problem like that.
So some of those, like, sometimes taller, lankier builds. I mean, I had a friend in, undergrad, likewise, he would just get spontaneous pneumos from time to time. So probably not the best candidate.
Right.
I know you mentioned your article, COPD with air trapping, certain uncontrolled seizure disorders, or, ear and sinus pathology, or, recent thoracic surgery, just kind of some of the concerns, but also that's a relative contraindication, and that perhaps using lower starting doses can help to kind of mitigate some of that risk. And I know there was one other point I just wanted to touch on briefly here before I kind of get to closing remarks was, some of the negative studies that, apparently were using this subtherapeutic pressure, but at the same time, these sham groups may have actually still gotten therapeutic pressure, even just from that room air being slightly pressurized. So,
Right,
I
right.
mean,
It was just compressed air.
mhm.
They didn't have an oxygen concentrator. It was just compressed air, and there was a positive result.
A couple of more contraindications, elevated blood pressure, so you should really get that managed. And also two medications the oncologists and radiologists would prescribe, andromycin and bleomycin, the way that
Okay.
they should consult with their oncologists and radiologists.
Okay, because probably just because they function as alkylating agents, and in the same way that, integrative oncologists recommend against the use of antioxidant, rich therapies, at the same time that they're receiving their chemotherapy dose, but maybe waiting a little bit after, just so that we're not conflicting in the mechanism of action. So,
and then the acute sinus infection. So pass that over, and then after you're fully recovered from a cold and whatnot, and that would be one. And then, of course, equalization of the eustachian tube. That's a problem for a small percentage within the demography. So those are the things that we want to be mindful of.
Gotcha.
So yeah, early in an infection or stroke or condition, hyperbaric oxygen has been shown to induce apoptosis in the neutrophils, the lymphocytes, and some of the other cells. And so if that prevents chronic inflammation, that's a good thing. But if you do it too soon, so now you're reducing your immune effectiveness. So that's why I said, I don't know about the timing. I haven't seen enough to say, a week is fine or, 3 days is fine. But that initial inflammatory response should be done by a week. So after that, it should be okay. And it should not be a contraindication after surgery.
Okay. Excellent points. I'd like to give you both the opportunity to offer any closing remarks. Shah, would you like to talk a little bit more about, oxygen health systems and how they can help clinicians and patients that are, looking to, benefit from hyperbaric oxygen therapy?
Absolutely. So the 14 indications are given. What we are finding is the emerging applications of the exploratory studies and the benefits. Limited studies are done outside of those 14 indications. And our latest number of calls in higher numbers that we're receiving from surgeons and clinicians and practitioners, such as yourself, is the patients' improvements in certain conditions, be that an impediment of neurological issue or in case of PTSD and so on and so forth. So those are the things that we are hearing from physicians that, hey, we have patients. Do you know of other physicians who came to you for such and such, symptoms and whatnot? So we're seeing that. Pressure, as Dr. Thomas pointed out, for some reason, there's such a negative connotation about the low pressure, which is called small m, HBOT. But now physicians are saying, wait, before we prematurely conclude that there's no benefit, hang on 1 second here. There are plenty of benefits to be had from 1.3, 1.4, and 1.5. So that's another thing that we're noticing. It's not dead, it is alive. The mild MHBOT that is well into usage as we speak. As far as what we do and what we are offering, various number of products, 44 different products, both upright for people who have issues equalization of the eustachian tubes. They are not ready for supine position sessions, so they are going with the upright. So talk to one of our engineers, talk to one of our salespeople, and we will have the right kind of chamber for you and for your patients. And you can reach us at oxygenhealthsystems.com, oxygenhealthsystems, plural.com, and you could browse through the pages and ask us questions, be that a technical question or any other application-related question. We can work together as engineers and physicians to come up with a solution for you and for your clinics.
Excellent. Well, Dr. Thomas and Shah, I want to thank you so much today for joining us. Again, we had a great discussion on the importance of hyperbaric oxygen therapy, doing more than just delivering more oxygen, but supporting recovery in tissues where metabolism, circulation, and healing have been disrupted. And it's about supporting the recovery, and when applied appropriately and integrated into a broader rehabilitation strategy, it may offer clinicians another valuable tool for helping athletes recover from concussion and musculoskeletal injury. Again, I want to thank you both for joining us today. And again, our guests today were Dr. Thomas Joseph, a physician and fellow of metabolic and nutritional medicine with expertise in sports medicine recovery, metabolic health, and hyperbaric oxygen therapy. Dr. Thomas is a consultant for Oxygen Health Systems, and his recent NDNR article explored the role of hyperbaric oxygen therapy in concussion management and musculoskeletal injury recovery. We were also joined today by Shah Haq, an innovator and director of engineering and operations with Oxygen Health Systems. Thank you for joining us.
Thank you for inviting us.
This has been the Applied Natural Medicine Podcast, a production of NDNR, publishers of the Journal of Applied Natural Medicine since 2005. Access the full archive of case reports and clinical insights at ndnr.com. For subscriptions, partnerships, or submissions, contact us at editor@ndnr.com.